Hi, I'm Dr. Laursen, and I'm making this video because a couple of patients of mine, if not more, have asked me to put out a video about how I protect myself from upper respiratory infections, particularly while traveling, as it may particularly apply to what's going on today with this virus issue. So my background, I'm a medical doctor. I have certain expertise in nutrient therapy, nutrition, in herbal therapies that might be of use, particularly in this situation, also of food therapy in Ayurveda, and mind-body medicine. I sort of combine all of them, and sometimes I use homeopathy also. So I had put out at least 15 years ago travel packs for my patients who were more exposed to illnesses when they travel. And what I'm going to tell you about today is much of what is involved in that. My first thing I want to say, though, at this point anyway, is to say that I am not selling any products. I'm not selling this product for any company. I'm not selling it myself. And I do have books out there on holistic health, but I don't sell those anymore. You might find them online somewhere secondhand, but so none of that is going on. I just want to put this out for the elite who wish to maybe do more, know more, and protect themselves. I will give some explanation as to why I say what I'm saying. So, let me start out with this virus. It does seem like a lot of what is being done out there in the world is a little bit overdone. However, you really can't blame the authorities because they're dealing with an unknown to a certain extent, and it's better to overreact than underreact. So that's the current situation. Let me tell you about how to protect yourself from any respiratory infection, put things more in your favor. I'm going to use one little visual. For me, I see things as this. This is a ratio. The number of viruses you get into your body divided by or over your immune system health. This is what it boils down to. Getting this virus, like any respiratory infection, is not a simply yes-no thing. Clinically, in the end, it might be that. But it really comes down to how many viruses or any pathogen gets into your body. For example, you could have perhaps 1 million viruses on your forearm, your skin. Skin's very protective. It probably will never get into your body. But through the eyes and through the mouth, potentially through the nose, the mucosal layering is different than skin. Things are more permeable. Things can get in, pathogens such as this virus. So it really comes down to the quantity of viruses get into your system, which is where a lot of these recommendations, some of those you have heard before, some you will not have heard about, are useful to decrease the number of viruses that get into your body. Now, to show you as an example how this works, there's something called Montezuma's Revenge. It's a diarrhea from traveling out of country, or it's based on a strain of E. coli, which is natural to the body, but certain strains are more virulent. Some scientists have estimated it takes millions of these E. coli to get into your body before anyone even knows they have any disease or symptoms, which are very mild. Diarrhea, for example. Other things like bubonic plague, science didn't really exist in the time period, but that happened, but it was considered by some to be so virulent that even if you got like 2 bacteria into your body, it would cause a disease which you could then suffer from or then die from. So obviously I think this current virus situation has a virulence or that's somewhere obviously between the two, right? It's not that deadly, but it's certainly far worse than other kind of illnesses. The actual number of viruses you have to get into your body to cause disease, they don't really know yet, but it's going to be a certain quantity. It isn't one, most likely, okay? So that's the first thing to know. If you can just reduce the number, things are in your favor. This is where a lot of these social recommendations are coming out. Years ago, when I told people about what I would do when I traveled personally, and I've done this myself, is I would take certain herbs and nutrients along to boost my immune system, which was the bottom of the equation. But I always tell people take an N95 mask years ago. It doesn't mean you put it on, but when you go to another part of the country where there are people living, viruses and etc., where you're not at, you're more likely to get something. Also on a plane, people more congested, someone sick next to you, you can put a mask on and use it potentially. So in this current situation, of course, you've seen everyone with masks. It's been said that masks should only be worn by people with the disease and not everyone else, but I think that's false. If someone has a disease, and I'll show you a couple of masks, they wear a different mask, a regular mask and an N95 gray mask, turquoise. They put them on to trap the particles of viruses. Both will do it. Even with someone with a disease, obviously some air is going to go around the mask, everything isn't coming through it. If you were to wear the mask yourself, you would also protect yourself from getting the mask, anything that's in the air. The way masks work is been explained by some people, and I'll go through it one more time. If a bacteria was the size of a house, a virus would probably be the size of a mouse in that house. So the pores of an N95 are smaller than this, but they act like a grease splatter for a frying pan. If they can trap the particles, they will trap the viruses. Most viruses are not, and bacteria are not traveling in the air or flying along. They're on some kind of dust in the air, or a water molecule, or water, particles in the air. Or if you cough, then it's mucus, watery things are in the air. Don't always see them, but they're there. What the mask does, it traps those particles and hence stops you from inhaling any or much of that. If you are have the illness, and you're definitely contaminated, or if you go to an area where people are definitely have it, you'd probably throw away your mask every day and get a new one. For the average person, one mask, that's all you would probably want, unless you definitely got exposed. Keep it dry, keep it clean, and you will have no problem. You can reuse it. The only time I would not buy a mask is in this current situation. There's been concern that the health authorities, like people in the hospital, cannot get them. They're running out of them. So for public good, you might not want to buy a mask now and just let people who really need it get it. But at other times, you might want to get a mask and just have it at hand for traveling. It doesn't mean you'll use it, but you might want to use it. You don't have the option to use it if you don't have it. So an N95 is a smaller pore mask, and that's the kind I recommend getting over the other. As you can see, I'm wearing a scarf. I like to keep my neck warm. I think keeping the neck warm is protective from illness, upper respiratory illness. And if you are somewhere and you wanted to sleep on a plane, you could breathe through your scarf even, impromptu. Things like that can work. So currently,